Hi, good evening, everyone. Today I want to talk about antibiotics because I see patients every single day, and almost 90 to 95% of them are taking antibiotics the wrong way. Now, I'm not against antibiotics. Sometimes they can save you from a life-threatening disease, and in most cases, it can add to the quality of our life in certain instances when it's not used the wrong way. Now, the problem with antibiotics today are many people are taking it without supplementing the right way. When I'm talking about supplements, I'm not talking about supplements that you need to go out and buy over there when you're taking antibiotics. I'm talking about when you take an antibiotic, you also need to be prescribed a probiotic and a B complex. Now, you can get a B complex over the counter and a probiotic over the counter as well. And it's usually mandatory for any health professional to tell you that you need to take a probiotic and a B vitamin, a B complex vitamin, along with an antibiotic. And let me explain to you why, because when we understand how these things work, then we remember to do it the next time, or we remember to remind our health professionals that we need to do this when we take antibiotics. Number one, antibiotics work on bacteria. So taking an antibiotic for most viral infections is just useless. When we take an antibiotic, it wipes out a lot of good bacteria from your gut. Now, we all understand the health of your gut is extremely important. 75 to 80% of your immunity and your health starts in your gut. And that houses colonies and colonies of trillions of bacteria, good and bad. So when your bad and your good bacteria ratio changes, so for example, when you take an antibiotic and you're constantly flushing out good bacteria, you need to replenish it. And along with that, antibiotics also flush out a lot of your B vitamins, which is why sometimes we get diarrhea or we have loose motions when we take antibiotics, because they flush out B vitamins, which help you to have the right kind of stools. So the next time you're taking an antibiotic, make sure you take a probiotic and make sure that you take a B complex as well. You know, we need antibiotics and we need medicines, but we need to make sure that the collateral side effects do not damage our health in the long run. So we need to make sure that we're managing our medication the right way to prevent any side effects that it can cause to our body. So you need a good probiotic and you need a good B complex. Remember to ask for that in case your health professional forgets to mention that, because too many people are taking antibiotics and the side effects are massive when you're taking antibiotics. Let me explain. A child, for example, if required to take an antibiotic course for 5 days, that's a broad spectrum antibiotic. It wipes out almost 1/3 of the child's good bacteria, which means the child is then going to have low immunity and can develop allergies and skin problems and just anything, any complication that comes along with low immunity. And it's the same for an adult. So when we're on medication, we also need to look at good solid nutrition and good solid rest, because remember, your body heals and recovers. Your cells heal and recover while you sleep. Have a good evening, everyone. Eat smart, move more, sleep right, and breathe.